They told her, you need to get this surgery within 3 weeks. This needs to happen. It's incredibly serious. And we waited. We waited and we waited. Now this is going on from early August now, and she passed away in mid-October. That's how fast it happened. Thanksgiving dinner, and she went home and she called my sister, who came, and she was in the midst of a heart attack when she showed up.
Manitoba patient Debbie Fewster, mother of 3 and grandmother to 10, died on a waiting list in 2024 while waiting for potentially life-saving heart surgery. At the beginning of August, Debbie was told that she had multiple blockages around her heart and required surgery within 3 weeks. But the healthcare system never provided Debbie with surgery within that 3-week period. She ended up waiting over 2 months and never received an appointment. Tragically, Debbie died waiting for surgery. Debbie's children and grandchildren were robbed of precious time with her by a healthcare system that too often fails to deliver surgery in time.
This has been really hard on our family. One of the hardest things I ever had to do was tell my kids or grandchildren. I had to wake them up in the morning and tell them that their grandma was gone. It's been devastating. I have 2 sisters who both also have multiple children. It's been unreal. It's almost hard to believe it's even happened. She was a huge part of our lives. We had a wonderful relationship with her, and to have her taken so suddenly is really hard to process. It never gets better. It always hurts. It wasn't like she was in her 90s. She was in her prime. She was just really settling into retirement. She had a lot of things left she wanted to do, and our family's still reeling because of it. It's just really dark because there's just no answers, there's no closure. It was just a failure.
Sadly, Debbie's story is not a one-off case. Government data shows that between April 1st, 2023 and March 31st, 2024, so a 1-year period, over 15,000 patients died in Canada while waiting for various surgeries and diagnostic scans. Everything from heart operations and hip operations to MRI scans and CT scans. But that figure is incomplete. Many provinces simply don't track this problem. If they did, the true number of patients that died on waiting lists last year is likely closer to 28,000. Ontario Health data shows that in a 1-year period, 378 patients died while waiting for cardiac surgery or a cardiac procedure. In most cases, patients are dying while waiting for surgeries that affect their quality of life. Hip operations, cataract surgery, and so forth. Some try to dismiss these cases, but would you want to spend your final years with cloudy vision or stuck in your apartment coping with crippling pain while you wait for a hip operation? We know these stats about waiting list deaths not because governments are transparent about what's going on, but because our organization filed freedom of information requests with governments right across the country and often had to pay money to get the data from the government.
The night she passed away, the responding police officers and first responders did their job as best they could, and my sister and I, who were on scene, were, well, I'll speak for myself. I was complaining about how she was on a list and she never got a call and was complaining about the system and the perceived failure of it. One police officer interrupted me and said, "I've lost 2 family members to this as well." And she said, "You would not believe how many calls we respond to where this is the situation. People died waiting on a list." She said the amount of times that they respond to this would shock you. That's disturbing. The system does not seem to be accountable at all. We have no idea what to do. I'm not even upset necessarily with her doctor. He rushed her in, he did his job. The specialist rushed her in, he did his job. Where it got hung up was with the hospital and the surgeons. We have no idea who to talk to there. There's been nobody who's reached out to us. We don't have a clue why she was pushed off for so long, other than what the nurse said to her one time was that they were catching up from the vacations that were taken during the summer.
The healthcare system requires many different changes in order to improve. But here's one idea that could be implemented relatively easily. Pass a Debbie's Law. If the government knows that it cannot provide potentially life-saving treatment within that recommended time frame, then it should be upfront and honest with patients and let them know that they may want to look at treatment outside the province.
If my family had known that they weren't going to be able to get to her in time, without a doubt, without a hesitation, we would all have remortgaged our houses. We'd have explored different options, probably in the States, maybe Mexico, overseas, wherever. We for sure would have sought out the private healthcare system somewhere, and we would have done everything in our power to get her there as quickly as we could.
You can learn more about Debbie's Law and health reform at secondstreet.org.